Hi, I'm Dr. Delos from North River Dental. A lot of times when we have a tooth taken out, the dentist may suggest you need a bone graft. Or you might have had some teeth taken out in the past and now you're looking to do a dental implant and there isn't enough bone there, we have to do something called a bone graft. Well, why do we have to do bone grafts? This is a model here where we can see teeth and bone. People don't realize this, but the reason I can pull teeth is teeth don't grow out of the bone, they grow out of your gums. The gums are little strings that hold the teeth to the bone. So the teeth sit in this trapeze of strings in the bone. So when I go to pull a tooth, I'm literally cutting those strings so the tooth can come out. And why is that so important? Well, as we chew and eat, our teeth move ever so slightly, like about 68 microns. And that stimulates the bone and keeps the bone there. So once a tooth is removed, we start losing bone. And we can see that over time, we get less and less bone in our mouth. Why? Because there's no stimulation to the bone anymore. So when you come back and you want to get a bridge or a partial, years after a tooth has been extracted, we have to do some extensive grafting. And in our practice, we have amazing results on the way we graft bone. We do something called PRF. We literally take some blood out of your veins, we spin it down in our centrifuge, and we pull out all the healing properties. So by using your own blood to make our bone graft, we get accelerated healing and we also get an amazing result. So we're talking a little bit about bone grafting and why we need it. I want to talk a little bit on how we do it. So as I said before, as we lose a tooth, we lose bone. So if you're going to have a bridge made or a partial made, we need more bone there. But most of the time we do bone grafting in conjunction with placing an implant. The way we do that is we clean the bone nice and clean, and in our practice we use something called PRF. And the PRF is your own blood, and we get such a great result because we're not getting anything out of a tube or a bottle from someone else. We're getting it all from you. We can also add exosomes or periosomes to the grafted material and get even a better result. So if you've had issues before with bone graft failing, if we add some exosomes to that bone graft, I can assure you that it's going to be an excellent result. So a lot of times what most dentists will do is they'll graft the area for the implant and they'll let it sit for 6 to 8 months. And that's okay. That's the way we used to do stuff 20 years ago. But like I said, we use PRF here. This is 2025 and we like to do things that are working today in today's environment. If we graft you, like I said before, the bone isn't being stimulated and it's going to dissolve away right away. So in our practice, what we try and do is graft the bone the same day we place the implant. And we find out if we do it that way, we get a much better graft results. But of course, we're asking God to do a bunch of miracles at one time. We're asking Him to grow bone and also asking Him to grow bone into an implant, which is a piece of metal. So in our practice, if that doesn't work, which usually about 80% of the time it does work, it doesn't matter because now we have that implant that acts like a tent pole and it supported our bone. So even if the implant doesn't integrate fully into the new bone graft material, we just unscrew it and place a new implant in and it works wonderfully. So we're losing no time. So if you're thinking about getting an implant and you need bone grafting or if you need sinus augmentations, give us a call, 941-722-0502. Ask for Delia. She's our facial aesthetics coordinator.